We have found that there are many benefits to creating a dedicated unit for health professionals and housing and treating health professionals on that unit together. Some of the most striking benefits are that when someone arrives new to treatment, it's a great relief for a physician or a dentist or a nurse to walk into a unit that's filled with other health professionals, many of whom are further along in this procedure of recovery, who can kind of normalize their experience, who can reassure them that they're not alone in this journey and that they're not worse than anyone else because they've fallen prey to an addictive disease.
And it's very important that they get honest about how their addiction may have impacted patient care. These are things that are anathema to them. They do not want to talk about patient care issues that may or may not have happened as a result of their addiction unless they're around healthcare professionals that understand that that could have happened and that they feel safe around those other healthcare professionals. Healthcare professionals over-rely on self-efficacy, and as a result, they have different spheres and domains of their lives affected before work gets affected. In fact, work is the last thing that is affected. And once work is affected, they oftentimes are intervened upon or acknowledge that they need treatment, and that's when we see them. And that over-reliance on self-efficacy is a huge hurdle to surrendering to a process of recovery. And we work very hard with healthcare professionals to get over that obstacle so that they can access a spiritual journey of recovery.
Caron offers a health professional team that includes physicians, psychiatrists, psychologists, counselors, and spiritual care providers, all of whom are collaborating and working together to continually assess and provide treatment during the treatment experience.
In the case of a healthcare professional with a chronic pain issue, the first thing I like to do is take a very thorough history and find out what was the cause of the pain, or what treatments have they had for their pain, what treatments have they administered to themselves for their pain, and what their expectations and goals are. The latter may be very difficult. It's often difficult for a healthcare professional to really assume the role of a patient and ask for help. We are trained from early on in our careers that we are the help giver and not necessarily the help taker. So in a case where chronic pain is negatively affecting a healthcare professional's capacity to work, oftentimes their tendency is to muscle through it. We know certainly that resisting pain problems is not conducive to healing from pain problems. Healthcare professionals often have a difficult time turning over their care to another professional. With respect to chronic pain, part of this is because healthcare professionals are very familiar with the mainstream treatments for chronic pain. These usually involve drugs. At Caron, we try to use some safe medications, but our reliance is primarily on non-pharmacologic treatment of chronic pain. I like to educate healthcare professionals on the use of modalities such as yoga, acupuncture, medical massages. These are tremendously helpful, but not considered mainstream by many physicians.